Hello, my future DAs. Today we will be discussing Chapter 17. It's called Introduction to the Dental Office and Basic Chairside Assisting. We're going to be talking about dental office designs and things that need to be included in a successful dental office. I'm going to read you the introduction to this chapter right now. Dental offices have numerous designs, including a single building, a medical/dental complex of individual units, a remodeled home, a suite in an office building, or space in a mall. Dental professionals go to great lengths to ensure that their offices are clean and convenient and offer pleasant settings for patients. The dentist's vision and expectations are reflected in the office design, which should always consider the patients the dentist serves. The practice may serve families, primarily children, or primarily adults, and may be in a rural or an urban setting. The most successful practices encompass all facets into a welcoming atmosphere where dental treatment can be provided. The appearance of the dental office makes a statement about the dentist, the dental staff, and the quality of the dental care. The following information describes the rooms in the dental office, the specific equipment used by dental professionals, and the concept of chairside assisting. So get your green books out and go to Chapter 17, and that is page 354. And you can look on page 355 actually and look up dental office design. So my next slide is going to be the reception room. In the reception room, you want a pleasant atmosphere. You have the reception desk and the business office. Also, you want a nice open area that it gives the first impression to the office. It's important that the room is pleasing and comfortable as well as neat and clean. You also have the reception desk and business office. You want to make sure it is adjacent or part of the reception area. So this is where the patients are received when they first arrive at the office. Then you have your sterilization area where all the instruments are clean. It should be near the treatment rooms. It should be neat and clean at all times. Then you have your dental office laboratory. So the lab is where it's a separate area and it's also well vented. And the amount of lab work done in the office depends on the dentist's preferences. The dental lab may be used for finishing or adjusting crowns, bridges, partials, or dentures, for pouring impressions, trimming models, polishing removable appliances, and making custom trays. There are so many things you can do in a dental laboratory. X-ray processing room is if you have the manual processing tank. It's not for digital. So the processing room holds the processing tank, of course, and all of the equipment and the drying rack, space for storage, things like that. But if you have a digital, you don't need a processing room. There's a radiography room where you would take Panorex x-rays. Of course, you're going to have the dentist's private office. A lot of offices have a staff lounge which holds a refrigerator so you can have your lunch or snacks. And then a patient education area if you're trying to propose a treatment plan to a patient. Treatment rooms, of course, you have your dental chair. And I want to talk about the supine and subsupine positions. So whenever the patient sits in the room, you have an upright, in the chair, you have your upright position where the patient just gets in the chair and sits straight up. Then you have your supine position, which is a reclined position, and that's with the nose and the knees on the same plane. Or you have a subsupine position, which is also a reclined position, but with the head lower than the feet. The type of procedure, the dentist's preferences, and the area of the mouth that is being treated determines the position of the chair. The upright position is used when seating and dismissing the patient, taking radiographs, and the dental chair is also designed to accommodate children and adults. You have your dental stools, which the dentist sits on, or the assistant, and your operating light. So in the treatment room, which is also called an operatory, you have a mobile cart. Sometimes you don't have a mobile cart. Sometimes you have a counter, your air water syringe. Sometimes the dentist only has it on his side. Most of the time the assistant has one and the dentist has one. You have the dental handpieces, your ultrasonic scaler, which the hygienist used to clean tartar off the teeth, your saliva ejector, and your HVE, your high volume evacuator. In the rooms, you also have the cabinetry so you can hold supplies, a sink to wash hands. We have dental x-ray units in ours, which we share, dental air compressor, and the central vacuum system. We have some of that in a separate closet in our building. You also, in the treatment rooms, you also can have the x-ray view box. And again, that's where if you have the manual processing with the older x-rays. Dental curing light from when you are performing composite procedures. The amalgamator if you're performing an amalgam filling. Communication system and computerized equipment. Now the communication system, a lot of offices have that. It is to let the dentist know when he's needed in a room, or the hygienist, or let the assistant know when the patient is here. It's often color coded, and it'll make a dinging noise so you can look at it. So let's see. Name the types of dental unit delivery systems and state a benefit of each. This is a dental check. Types of dental unit delivery systems and state a benefit of each. So you would have, the dental unit consists of handpieces, an air water syringe, a saliva ejector, an HVE, an ultrasonic scaling unit, and numerous other options. The dental unit may be fixed to the wall, the cabinets, or on mobile carts. The unit is positioned according to the preference of the dentist, whether the dentists are left or right-handed, whether they routinely work with assistants, and according to the design of the treatment room. The dental unit is available in 3 basic modes of delivery. Number 1 is the rear delivery system, and that's designed with the equipment behind the patient's head. Then you have the side delivery system, is designed with the equipment on the dentist's side. The unit is mounted to a movable arm or mobile cart. Then you have your front delivery system, is designed so that it can be pulled over the patient's chest and is in between the dentist and the assistants. When you go into different dental offices, you will see all the different designs these dentists have. So you want to make sure you come into the office and you have a daily routine to open the office and a daily routine to close the office. So that will be discussed in Chapter 17 also. If you go to page 369, go to Procedure 17-1, it'll explain the daily routine to open the office in most offices. Go ahead and look at that, and I will end this PowerPoint right now, and we will continue another day.